educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Educational purposes only. The content is not intended to die. All right. Hello, everybody. Welcome to Daily with Doc. My name is Becca Dukes. Let's go ahead and open up that waiting room and let people into our live Zoom here at DailywithDocZoom.com. All one word. Put it in the URL and you can join us live Tuesday, Wednesday, Thursday, Friday. Most weeks from 12 to 1 p.m. Pacific time. So I'm excited for the month of May. We're going to be adding into Tuesday into our programming on Daily with Doc. Now, Daily with Doc is brought to you by DailywithDoc.com, where myself and my team have put together a resource for an amazing community. So we want to make sure that if you were invited by somebody specific, that you get back with them. Tell them thank you for taking the time and sharing with you what you're going to be hearing today. So if you are not talking or not working with anybody, have not spoken with anybody about anything that's mentioned on this program, and you found us on your own, then you are more than welcome to use our website for more than just a resource, as we do have the Good Foods, Bad Foods list. We have a store there. We also have a contact option and email. Actually, the email is for everybody, so that you get notifications of when we are live and get notifications of replays. That makes it easier for you to help yourself. And as we're helping ourselves, why not help others as well? So folks, you are watching Daily with Doc. As an empowered individual, we are excited to be able to share this information with you, because you're not going to hear it in going to those big buildings that are full of white coats. Not because they don't care. It's because this is not something that has been taught in medical school. We look at a more natural way to address health. That is through nutrition, because when there are nutrients missing, the doctor that we have on with us through 3 postdoctorates found that there are over 600 different poor health symptoms associated with nutritional deficiencies. And you're going to be hearing about some of those today, and some things that you may have maybe never heard of as being the root cause. So buckle up, sit tight. we are in for a great show as we are looking at nerves in a pinch, how the thickening skull can cause nerve trouble. Along with other things, there are going to be things that you may have never even thought of, or when you do think about it, how is that possible? Well, Dr. Joel Wallach has a Bachelor of Science in Agriculture in Plant and Soil Science. He went on to become a Doctor of Veterinary, where he worked his way through veterinary school in the pathology lab. And through his reports that he did with some huge, actually, projects that were jumped in his lap, one of his papers published got him the spot as the lead pathologist with a show that you might, if you're close to my age or older, remember, Marlon Perkins' Mutual Omaha. It's a Wild Kingdom. So Dr. Wallach worked very closely with him. In fact, he went to South Africa as the white rhino was facing extinction. Dr. Wallach was very instrumental in helping to create that conservation effort in making sure that they're getting what they need. One, finding out why are they going to extinction, besides the obvious of poaching and needing, the different parts of the animal for different types of medicine, but making sure that their environment and habitat had what they needed so that they could thrive. And with that, they went from around 200 or so, Dr. Wallach, to now there's like 16,000, 18,000 white rhinos. And
It's 350 when it started the project.
350. Okay.
And we caught 250 of them.
Okay. That's where I got the 200 something. So anyways, with his research then, after that, he went to work for the Reese's Primate Center and found the first
Yerkes Primate Center.
Yerkes Primate Center. I'm really doing good today, aren't I?
Is a Reese's monkey.
The Reese's monkey. That's right. So, folks, cystic fibrosis, it is not just a human disease. He found the first non-human case of cystic fibrosis. And actually, before telling him that these slides were from a Reese's monkey, he sent it to him to confirm that it was, in fact, cystic fibrosis. They confirmed it. Then he told them that it was from a Reese's monkey. And he also went to the extent of checking to see if there are other monkeys that were not related were actually affected by the same thing. And sure enough, they were. So that proved that it was not human and it was not genetic. So that in itself was such an amazing find that Dr. Wallach found. But they didn't think so because it was against their narrative, so he got fired. But that pushed him on to bigger and greater things as he started teaching nutrition at a naturopathic college. He then went on to become a naturopathic physician so that he could treat humans legally. And through all of his research, he found that there wasn't the nutrition in the food. He wasn't finding it in the products that were available at a quality that met his expectations. So he put together a team, put formulas together that went from the common 8 to 26% absorbability to over 90% absorbability in the products that he and his team put together. So you are actually in for an amazing treat, folks, as Dr. Wallach has been looking at nutrition and implementing it for 74 years. And he's still going strong, wanting to make sure that this knowledge is reaching the world as he has put this crusade to save humanity and the world together, which is the name of one of his books, which is actually a flip chart that goes through and shares about himself, his wife, Dr. Milan, the work that they have done and people that they have helped. So make sure you go to drjwallach.com. You can get the flip chart there, along with 23 other books that he has written and published. And there's another one on its way, hopefully by the end of May. Oh, that rhymes. But anyways, without further ado, let me introduce to you the one, the only Dr. Joel Wallach from his comfortable home. Dr. Wallach, thank you so much for joining us today. How are you?
Okay, well, thank you for the kind introduction and sharing our story with our viewers. Appreciate that. And of course, you point out we have this new project coming out that you're a major piece in this as far as putting this book together. So we're very, very proud of all your efforts. You're
So
a
I have
co-author.
bags. Is that
Yeah, you're a co-author. And so that's exciting. Okay. And so it's you and Dr. Milan and me are the three authors of this new book coming out. And then, of course, we have some other interesting people who have letters to the editor and that kind of stuff in there. Okay. And so this is very, very exciting. And it's going to be literally a companion book to It's All in Your Head. It'll be about the same external measurements on the outside. Okay. It's all in your head. Okay. Which has 30 pages, 30 pages.
Yeah, but the next one, Dr. Wallach, is about twice the amount.
Really? So it's going to be 60, 70 pages. This is the second one. Okay.
Yeah, I think I'm at 78 pages at the moment.
Oh my gosh. Okay. Well, goes after this disease. It's worldwide. Okay. Again, it was originally thought to be genetic, and still in most places, I think it's genetic. It's really just a simple nutritional deficiency disease. And we're talking about the metabolic syndrome. Okay. That's going to be the title of the book, the metabolic syndrome. So we're very excited about that. And those two books, when you buy them together, you have a nice discount. If you buy 10 of It's All in Your Head, you get a discount. You buy 10 of the metabolic syndrome, you get a nice discount. And so we're trying to get this information out there because we can save so many people's lives. We can add so many healthful years that are free of misery and save them an enormous amount of money, okay, as well as eliminate misery. And just basically, when you look at the metabolic syndrome, it was first identified in 1945 by a group of doctors who were doctors. Okay.
Don't give too much information away about it.
Okay.
Because today we're talking about this.
I know.
Okay.
Okay. It's on your head. Okay. Go to page 6.
Yes, sir.
Open that up and you'll see there's two pictures of the skull. Both of them, the top of the skull been removed. The top one, the skull's been removed. You're looking down on the brain, and you can see the skull is a quarter of an inch thick. The bottom one, the top of the skull has been removed. You're looking down on the brain, but now the skull is 1.5 inches to 2 inches thick, because when you get osteoporosis, the bones and connective tissue and everything get bigger, not because of bone, but because of scar tissue and connective tissue and that kind of stuff, osteoporosis. And when it comes to osteoporosis of the skull, there's 12 pairs of cranial nerves, 12 pairs. So there's 12 cranial nerves come out the right side, 12 cranial nerves come out the left side, the spinal cord comes out of the back. They all come through holes and tunnels. And when your skull is increased, okay, by so much, 5, 6, 8, 10 times, it closes those tunnels that the nerves and spinal cord are going through, which produces problems, which produces disease, okay? And it's not genetic. Japan very quickly, when it comes to the metabolic syndrome, Japan is very high level, 40% of the population has it, okay? And the peak age, of course, of the metabolic syndrome in Japan is 50, age 50. 40% over the age of 50 have it. In the United States, 37% over the age of 50 have it, and 25% in the United States, okay, the adults, okay, 25% of the adults that have these metabolic syndrome are males. 25% are males, single males, okay? And so this is very, very interesting stuff, okay? And then, of course, when you look at the rest of this, osteoporosis of the skull goes along with osteoporosis of the body, okay. And of course, when you look at this, arthritis, we spend $626.8 billion, $626.8 billion each year just to treat arthritis in the United States. Just treat the symptoms, not we're going to cure it. Okay. And then when it comes to osteoporosis in America, osteoporosis, we spend 6.5 trillion with a T, 6.5 trillion. Then you throw in the ones that are being treated for arthritis, you have $7 trillion we're spending to treat osteoporosis and to treat metabolic syndrome. Now, the osteoporosis part, okay, it's a combination of the United States, Canada, and Europe. And this is crazy stuff, okay? And so we can save America, we can save the world, we can save our families, we can save American citizens an enormous amount of money, save an enormous amount of unnecessary misery, and add many healthful years to your life by getting rid of all the bad foods and maximize proper absorption and utilization. And this is something we've been working on for a long time. And so we have a lot of experience. We know what we're talking about here. And so it's very exciting. And of course, when you talk about all these other diseases that are involved, you'll see this in this flip chart. Okay. And there's so many famous people in there. You know, we're talking about movie stars and stage actors and actresses. We're talking about professional athletes. We're talking about Olympic athletes. We're talking about very wealthy business people. We're talking about scientists. We're talking about physicians. And they all had these diseases. And we were able to save them. They very graciously gave us a page or two on their stories. And in most of them, there's a picture of them, you know, a nice color picture of them. And you'll recognize, oh my gosh, they had this. Yeah, but you'd never know it because we're the ones that got rid of it for them. Okay, so we're very proud of that, of course. And this is something that's very economical. You know, you become one of the members of the family, so to speak, Parkinson's disease. Okay, for, I don't know, 25, 30, 40, 50 years, we're getting like 60,000 new cases of Parkinson's disease each year in America. This last year, it went up by 50%. We had 90,000 new cases of Parkinson's disease. And then, of course, we have a lady who is being treated by the medical system, and she's going in once, 2, 3 times a year for 11 years treatment, and she's gradually getting worse as they predicted. That was the story of how Parkinson's disease worked. And she came to us because her friends heard about us, and she said, well, I'll give it a try. So she came to us, and in 2.5 months, she was cured. She goes in for her regular exam, and they said, oh, there's something, we don't have anything here, so there must be something wrong. Let's have it come back tomorrow, we'll rerun it. They reran it, she didn't have it anymore. Okay. Her name is Madeline O. I'm just giving you the initial for her last name. I'm not giving you her last name because Madeline would be submerged with thousands of people if we told you her last name. And on this page, on the flip chart, the right-hand side of the page, she tells her story. Beautiful story, okay? How she's suffered for more than 11 years, almost 12 years with Parkinson's disease. And in 90 days, we were able to get rid of it for her. The left-hand side of that page is a combination of her letters and letters from the doctors who are treating her for Parkinson's disease. So these are the sort of things we have where you can see we're not just speaking nonsense. We're not just speaking theoretical stuff. We're speaking hard evidence by credible people, and we've been doing it a long time. And so we were moved to publish this new book, okay, metabolic syndrome. And of course, let's see here, Rebecca has been, which I, Dr. Milan and I have written, I don't know, over 23 books, and including the flip chart, okay. And then now we have Rebecca Duke's involved here, and she has done such a beautiful job, and we cannot thank her enough, because it's going to be a set. It's all in your head. And then she's telling me that, let's see here, the metabolic syndrome is about 70 pages, give or take some. And it's about double the size. It's all in your head. So these two books together will sell as a set. You can buy them individually if you already have it. It's all in your head. You can just buy the flip chart. You can just buy the metabolic syndrome, or you can just buy the metabolic syndrome and don't buy it. It's all in your head. However you want to do it. Okay. When you buy,
And it will be available by the end of May. It's not available yet, Dr. Wallach, but it will be available by the end of May.
okay, it's just that's what we're shooting for, the end of May.
By the end of May.
It's like 3.5 weeks away from now. Wow.
Okay, you gotta lighten up on me with the other stuff, Doc, so I have time to work on it.
Okay.
But let's go ahead and get on with the show, Doctor. No, you can't cut the show off short. No, we have people, waiting to ask questions. They've got their hands up. So folks, if you're here live with us in the Zoom and you'd like to ask a question, you're more than welcome to do so. We also have parts of our team who are watching the different platforms looking for questions as well. So they're going to be bringing in questions. Plus, I have questions that have been emailed or sent in from listeners just like you. So the first one, Dr. Wallach, that I have is from Bridget. So Bridget has a friend who is 57 years old, 240 pounds, 5'3". She has allergies, asthma, trouble with tremors, and uses a walker due to an accident. So it's not just because of, some type of something going on because of an imbalance or creating an imbalance. There was actually injuries that helped with that need for a walker. So Dr. Wallach, when we're working with somebody who has allergies and asthma and tremors, what would be the underlying cause of all of these things?
Well, lack of nutrition to maintain and protect all the cells and tissues and organs and systems of the body. Because somebody who's 5'3" shouldn't be 240 pounds. Okay. 5'3", this gal's over 100 pounds overweight. Okay. And so there's something really serious going on here to cause all this pica and cribbing, which is the term given to just, I don't know, I've eaten 3 meals today, I'm still hungry. And so they have a fourth meal, a fifth meal. Some of the times they'll eat 10 meals in an hour. Okay, instead of taking nutrients, okay, to try and satiate and stop that craving, they just eat more meals, and that's why they gain so much weight. So we got to teach people that when you have cravings and you're really hungry, don't eat 10 meals an hour. You only want to eat 3 meals a day, but the other time when a meal is due, you want to be taking something like our plant-derived minerals, okay? And the minerals, oh gosh, I wasn't so hungry after that, because it's mineral deficiencies that cause pica, okay, and cribbing. And it's called cribbing because when horses chew on the gate in the stall, or animals chew on the cage is called cribs, because they're minerally deficient, it's called cribbing, okay? And so this is where the weight gain comes from, and terrible, particularly mineral deficiencies, and it causes tremors. You may have osteoporosis of the skull, squeezing the skull. And of course, that's one of the things we want to put a little extra time on here. And this will help to go down this list. Osteoporosis of the skull. I know I've got it here somewhere.
Talking about the symptoms that can be associated to osteoporosis of the skull.
Yeah.
So like AFib and COPD, reflux, bloating, diarrhea, gastroparesis, hiccups, Bell's palsy, ONA, which is vision loss, vertigo, Meniere's, tinnitus, Paget's, trigeminal neuralgia,
You're reading my
spinal
book.
cord paralysis. Hey, I read the book.
Well, there you go.
Yes. So there's a lot of things, folks, and these are all, are many of them are medical diagnoses. And the content of this program is for educational purposes only. It is not to take the place of your primary care physician, nor are the products mentioned meant to treat, diagnose, or cure any dis-ease. But folks, when you give the body what it needs, the body itself can do some amazing things.
Yeah, it's just like when you get a blood test. Why do you get a blood test when you go to the doctor's office? Well, because when your kidney's not working right, the kidneys show up stuff on the blood test. When you have diabetes, it shows up in the blood test. Well, the same thing is true when you have osteoporosis of the skull. There's a list of diseases. There's 12 pairs of cranial nerves, and each cranial nerve, it can be just squeezed on one side. You don't necessarily have to be squeezed on both sides. Okay. And so when you squeeze cranial nerve number 1 from osteoporosis of the skull, or an injury or edema or something like that, you gradually lose your ability to have the sense of smell. Okay. And so you can be surrounded by smoke and fire and you wouldn't even know it. Okay. If cranial nerve number 1 is being impinged upon, and so you can't smell the smoke or food cooking. Okay. Cranial nerve number 2, and it gets squeezed, you get optic nerve atrophy. Slowly, you lose your vision. You go to the eye doctor, and every 6 months, you need a new set of eyeglasses. Okay, because the skull is getting thicker and thicker and squeezing more and more on the optic nerves. Okay, so the optic nerve atrophy is a big thing in the human population, especially when you get over 50, 60 years old and you're into the osteoporosis of the skull. Cranial nerve number 3 gets squeezed, you get ptosis. Pupils not responding to light, that's very typical. Okay, cranial nerve number 4 being squeezed, double vision, palsy. Okay, palsy, pain, increased eye pain, and so forth. Cranial nerve number 5 gets squeezed, you get trigeminal neuralgia, very painful. Okay, in the face. Cranial nerve number 6, double vision, called strabismus. Cranial nerve number 7 gets squeezed, you get Bell's palsy. One side, usually one side starts first, your face droops and you look like there's a 50-pound weight hanging off that one side of the face. Okay, cranial nerve number 8, tinnitus, ringing in the ears, deafness, vertigo, dizziness, Meniere's disease, all that kind of stuff. Also, the tinnitus, okay, very, very important, because all this stuff has to do with balance. When you have a balance issue, the odds are your 8th cranial nerve is being squeezed. Okay, and cranial nerve number 9 getting squeezed, you lose the gag reflex, can't swallow properly, you lose your sense of taste, your voice changes. Cranial nerve number 10 gets squeezed, gastroparesis. Okay, that's the stomach doesn't work very well. COPD, chronic obstructive pulmonary disease, that's the lung stuff. You get hiccups, atrial fibrillation. The heart doesn't beat properly. It doesn't go lubbed up. It goes okay.
You're pretty good at that, Doc.
It's pretty good, yeah. Well, I've seen a lot of those. Gastroparesis, COPD, hiccups, AFib. That's cranial nerve number 10, the vagus nerve. It starts up in the brain, goes down your neck, okay, goes all the way down to your toes. The doctors want to amputate your toes because you have pain in your toes and they can't seem to get rid of it. So we'll just cut your toes off. That's because it's all happening up here. They don't remember their anatomy from class, and they certainly haven't read the book. It's all in your head because they're missing that one. Okay. Cranial nerve number 10. I love the pictures. You can open up that book again. You see the skull and you see the brain in the skull, and then this spinal cord, go to another page. inside.
okay.
I want to see the whole skeleton. And so the spinal cord is going down from the skull all the way down and to the pelvis. And then the cranial nerve number 10 goes down on each side. There's one on each side, cranial nerve number 10. There you go. And so this shows you what's going on. Okay. And there's a picture, I think in another page later on in there, it shows the whole picture where it shows the brain all the way down to the feet. Okay. And so I think, yeah, farther down in the book. And so, okay. Cranial nerve number 11 being squeezed. This has to do with also the spinal cord and the cranial nerves number 11. And so you get, let's see, you can't lift your arms, okay? Loss of the trapezius muscle, okay? Okay, and that's because those nerves are being squeezed up high. Cranial nerve number 10 being squeezed, atrophy of the tongue, speech changes. So when you get the 12th cranial nerve being squeezed and the 9th cranial nerve being squeezed, you're in trouble with communication. Speech is almost impossible. Just a lot of crackling and stuff like that. But this is all reversible. Get rid of the bad stuff. No fried foods, no processed meats, no oils, no glutens, no meat, no butter, no oats, no buckwheat, no sugar, no carbonated drinks. That one's got to go. Take the healthy brain and heart pack. Take the I-26 to rebuild the myelin, white matter of the brain and spinal cord. And you also want to take the Ultimate Daily Classic tablets that will give you circulation and normal blood pressure. Okay. And so we have what we call the secret sauces, and we gave them names. We didn't just say, okay, we're going to give you more calcium. Okay. We gave these products names because people would say, oh, I need more calcium. So they just go to the grocery store and they get some calcium and they take it, and it didn't work because they didn't get the other 89 nutrients to make the thing work. Okay. And so that's why we have names for all these various programs and so forth. And people will say, well, what is it? Well, when you see the formula, there's going to be over 90 essential nutrients in there. And, you read the book, it's all in your head. You read the book, Epigenetics, you read the book, Rare Earths and Cures, you read the book, The Wallach Revolution, and so on and on and on. And it tells you what each nerve and what the nerve cells do. Okay. And so this is stuff the doctors don't get. Doctors don't get this. And these books, they run 500 pages. Epigenetics is it 500 pages? I think it is.
Let me look real quick. Before you get to the glossary, which I think is really cool, Dr. Wallach, that you put a glossary in this. But before the glossary, you're looking at 509 pages.
And then the glossary is what, 10 pages or something like that?
And then the glossary is looks like it is another 40 or 30 pages.
Okay, well, there you go. So it gives you a shortcut to go to where you want to go. Okay. But you can't just take one nutrient. Well, my doctor said this is a calcium thing. I should eat more cheese and stuff like that. Well, that's fine. I ate a lot of cheese. I ate stick cheese. I ate square cheeses. I ate the
shredded cheese, all different types of cheese.
Yep. And so
cheese is good for you, Doc?
Yeah. Well, it's a high quality protein. It's made from milk. What is the most nutritious food produced by a human being?
Mother's milk.
Mother's milk. Well, there you go. And so we try to match all the good stuff in our programs, but there's a basic core of the 90. That's what I say, the 90. Okay. 90 for life. And you take the 90 and then you take more of the secret sauce. You take more when you have a problem, you take more of the secret sauce, and you can read the label and see what's in there. But if you just try to say, well, I don't want to spend $50 a month to get rid of my arthritis, my osteoporosis, and paralysis, and all that kind of stuff. I can do it for $5 a month with some cheese. No, it's not going to work. It's because you need all the vitamins to make the minerals work and all this and the other. So you need the entire formula. And this is the way it went 1,000 years ago, 2,000 years ago, 3,000 years ago, and in some places 5,000 years ago, where there was glaciers and glacial milk, okay, where the glaciers would grind up the minerals up in the top of the mountains, and the ground up rock dust would come down in the streams, and the streams looked like white milk. So they called it glacial milk, from glaciers, glacial milk. But it wasn't milk. It had 30, 40, 50, 60, 70, 100 minerals in it. And those are the people like the Hunzas who live to be 120. They don't have a single medical doctor in Hunza, but this is Rare Earthman Cures tells the story of the Hunzas, okay? And so this is one of those things where you have to appreciate that there's reasons why some cultures live so long. It's not a genetic thing. They're getting the nutrients they need for their body to maintain and protect itself. And so once I kind of learned that, doing all this pathology stuff when I was just, I was in pre-veterinary school. I wasn't even in veterinary school yet. I was doing all these autopsy things and all the biochemistries and looking at slides under the microscope. And I really saw, well, this is where information is at. And so that's why I kind of drifted that direction. And I'm still drifting that direction more and more and more. And we have so many things happening now, including this new book coming out, The Metabolic Syndrome. I'm so proud of this. I'm so proud of our team of Rebecca and Dr. Milan and myself. The three of us have put this thing together, and it is really, really, really is going to, what should I say, enhance the quality of life in humanity, and also their pets, because they can use a lot of this information for their pets. But this is stuff that was misdirected in 1945 when a team of doctors came out and said, oh, this is all caused by genetics.
Right. Well, Dr. Wallach, you had talked earlier about the cribbing, and with the woman that's 57, 240 pounds, trouble with walking and tremors, allergies and asthma. Many of those things, I mean, I didn't have tremors. I didn't have to use a walker, but I was 120 pounds overweight. I had asthma. I had allergies. And getting on your program gave my body what it needed to be able to thrive. And one other thing is, when your body's starving, it's going to hold on to whatever it gets. And it's going to make you want to eat more and more and more. But it's not calories that it's starving for. It's the nutrition. The nutrition going into my body, Dr. Wallach, the body was like, okay, I can let this go. And in that first 3 months, I lost 20 pounds, not even trying. So
it's a beautiful story.
It's amazing what the body does to protect itself, and what it can do when it's no longer in that fight or flight, and letting go and relaxing and just, getting onto a better health journey. Yeah, and that's what nutrition does.
Being on the correct path. And
yeah. So, Dr. Wallach, what would you recommend as far as the longevity products? Because you are the founder of the company Longevity. You are no longer part of the management of it. You have turned that over so that you can focus on helping people without them saying, well, you're only recommending these to make a buck. And folks, you can't take just this and that and do fractionated nutrition. Without those cofactors, the body can't fully utilize the nutrients that you're putting in. So you're wasting your money. So why not?
Let's get back to Bridget.
Okay. Bridget. Yeah. Bridget's friend.
Okay.
What would you recommend, Doc?
Okay. Well, she got to get rid of all the bad foods. I think we got through that, right? No fried foods, no processed meats, no oils, no glutens, no wheat, no butter, oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go. And at 240 pounds, she needs 2 healthy brain and heart packs per month. The full of this thing twice a day. 2 Heather Brandon heart packs a month, a full dose thing twice a day. And then because she has asthma, I also want her to have our Oxybody. She can have 2 servings of that a day. I also want her to have our glucogel. Okay, I want her to take 3 of those 3 times a day. And that's going to give her what she needs for her body to manufacture cartilage and ligaments and tendons and connective tissue, which the lungs, people don't realize it, how much of your lung tissue is cartilage and connective tissue and elastic tissue. Okay, and so you need that glucogel. Okay, and then of course the it's the
Ultimate Daily Classic.
okay, let's go with Ultimate Daily Classic. Okay, Ultimate Daily Classic. That'll be beautiful. Okay, and that's going to help, obviously, with minerals. Okay, also, she needs more of the EFAs, essential fatty acids. Okay, because this makes the hormones to dilate the bronchi, and this is how we got rid of asthma. Okay, and some very famous people. And so for the EFAs, make sure that she's taken, say, 3 at breakfast, 3 at lunch, 3 at dinner time, and 3 before bedtime. Okay, and that's going to, I've seen people with terrible, terrible asthma, very famous actors and actresses and stuff, and it just turns around in just weeks. Okay, the tremors, this can be happening because of things going on in the skull. So the I-26, 3 servings a day. I take 3 of those soft chewables. I like the French vanilla, but it also comes in banana coconut, also comes in capsules. It also comes in powder. But I take 3. I like the French. Okay. I like the
You like the
no.
French vanilla because it tastes like vanilla ice cream, Dr. Wallach.
Well, yeah, that's right. And that's why we made that one to make me happy. Okay. And so that makes the brain and spinal cord work better. Okay. Which helps. And of course, allergies occur when you're not able to digest food down to their basic components, and the bigger chunks of the foods get absorbed into your body. Your body looks at them as a bad guy because it's not been brought down to its essential basic components. Okay, and so again, our digestive enzymes wouldn't hurt for allergies to take 2 or 3 of our digestive enzymes per 100 pounds. So take say 3 of our digestive enzymes for this lady, 240 pounds. You can take 3, say 10 minutes for each meal. Why before the meal? Because I want those enzymes sitting there waiting for the food. I don't want the enzyme trying to chase the food down the pipe. Okay.
Right, you want to be in front of it.
Yes.
Because when you've got what's in the enzymes, you've got the ox bile, you've got the enzymes themselves that work on the fat, the protein, and the sugar. And I think there's some probiotics in there as well. So you get that digestive juices ready to break down that food. That makes sense than chasing it later. Absolutely.
Okay, we have wonderful results in this scenario. This lady can look to, and she's got to consciously, proactively work to get rid of all the bad stuff. Okay, and so at 5'3", I'd like to see her down to what, 125 for a lady. It'd be about right.
Yeah, I think that's about right, Doc.
125 to 130. But get down to 140. It's a big victory. Okay. And so this is something, well, how long does she have to stay on all this? Well, as long as she wants to stay alive. Okay, so just, how long do you need to keep putting oil and antifreeze in your car?
Well, it's a whole lot cheaper, Dr. Wallach, to be proactive than it is reactive.
That is correct. And
And you
the quality
base
of your life,
everything,
the quality of your life will be better too.
absolutely, and you base everything by weight. So as the weight comes down, then the dosages can come down as well. So you go to a maintenance dose instead of a reactive dose. So definitely something to consider, folks. And I just want to mention on that I-26, there are several studies on that hyperimmune powder that is proving to be beneficial in removing pathogens within the body. 26. That's why they call it I-26. So when you take those pathogens out that are causing havoc in the system, you have a better connection between the gut and the brain, in addition to that good cholesterol that supports through the liver, supports the healthy myelin sheath that protects the nerves and also the matter of the brain. So
And the software.
multi-purpose on that I-26, Dr. Wallach. It's pretty incredible.
Yeah, well, that
Well,
was, I'm so happy that our team agreed that we should actually come out with a product.
well, we brought in Dr. Glenn Winkle, and he's the brand ambassador for that product, and it's just been incredible. He himself a triathlete, and uses it for his pre and post workouts as a recovery also. So he gets great results with that. So Dr. Wallach, we have lots of hands. We only have 15 minutes here. And we did get a question as people were in the waiting room wanting to know about peripheral neuropathy. They have it in their hands and their feet. They did the nerve study and an EMG that does not look good. So there, it sounds like there's some damage to the nerves. So if this person is 150 pounds, Dr. Wallach, and 5'7", male or female, what would you recommend that would give the body what it needs to be able to fight against that peripheral neuropathy and those symptoms that come with it, with the pain, the numbness, the tingling in the hands and the feet?
Yeah, and you have to think, okay, we're going to include the brain and the spinal cord and all the peripheral nerves, okay? And so none of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no bar, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. Then 150 pounds is 2,000 heart packs per month, the full dose everything twice a day, okay? Then we need the, let's see here, I-26, okay, I-26. So you're going to go with the chewables, soft chewables. I'd go with 2 or 3 twice a day, or even 3 times a day if finances are not an issue. Okay, take three times a day, or 2 or 3 times a day. It's going to be very, very good. It'll freak everybody out how well the patients do on the I-26. We have so much experience all around the world now with the I-26. It's just amazing. Okay, and then again, I like the for circulation into the brain. You need the Ultimate Daily Classic tablets, 3 of those twice a day, even through blocked arteries. The Ultimate Daily Classic can get blood flowing again through blocked arteries into the brain, the lungs, the heart. And so even things like AFib, atrial fibrillation, peripheral neuropathies, which is all this stuff going on, pain and numbness and tingling in the fingers and toes and back, and it's all around the spinal cord, okay? Because when you're shrinking, okay, your spinal cord doesn't shrink as fast as you're shrinking because the disc between the vertebrae shrink, and the vertebrae get closer together and start smashing the spinal cord, okay? So this is all very, very important. And of course, we have the CM cream. CM cream can be used topically on any joint, whether it's your neck, your upper back, your middle back, your lower back, chest, your hips, your knees, elbows, shoulders, jaw. The CM cream is just a wonderful thing. You can use it, tells you on the label how to apply it. but basically, it gives you anywhere from 3 to 5 hours of pain and inflammatory relief. Okay, so somewhere between 3 and 5 hours. Okay, and so you can use it 3, 4, 5 times a day, depending on your schedule. And whether you have one knee you're trying to help out here, or your entire back, your spinal column, with all the different vertebrae, you're going to start have somebody help you put the CM cream on every one of your vertebrae from your neck all the way down to your tailbone. Okay, this can make your life miraculously better.
Yep, absolutely. Thank you so much for that, Dr. Wallach. So let's go to the first hand that is up, and that is Sherry. Sherry, what question do you have for Dr. Wallach today?
We have a question from one of our viewers, and she would like to know, it's a woman, about 152 pounds, around 5'11". She has MS and wants to know what she should take for the MS she has and what to take to make her knees stronger and her mobility better. She'd like to make her knees stronger to avoid knee surgery. She recently had a hip replacement.
Okay. All right. So, every joint in her body is afflicted. Okay. It's just, if she has to go up and down stairs, she has long walks to take to get to work or something like that. It's one of those things where this is why she has hip problems and knee problems. Okay. MS, multiple sclerosis. This is a combination, okay, of the brain. When you look at this flip chart, okay, on page 26, there's like 30 different diseases that are caused by loss of the mild and the white matter of the brain and spinal cord. Number 3 is MS, multiple sclerosis. The white matter of the brain is just going away. Okay. Okay, you got to get rid of the bad foods. Okay, but you got to get that I-26. Okay. Want to take 2 healthy brain and heart packs per month, full dose, I think, twice a day. The I-26, I'd go with the soft chewables. Okay. The French vanilla, everybody loves the French vanilla, and of course the banana coconut. You can take banana coconut at dinner time, and the other 2 or 3 times during the day, take the French vanilla. I just take all my doses French vanilla. I like that. Okay, but it's just amazing. In weeks, things turn around in a positive way. It rebuilds the brain, rebuilds the spinal cord. When doctors treat MS, they give you anti-inflammatory things. They give you things like cortisone and stuff like that. And it can give you some pain relief and some symptom relief, but you still continue to gradually get worse. You need the nutrients. And of course, with the knees and the hips and so forth, needs the, let's see here, don't forget the Ultimate Daily Classic tablets, 3 of those twice a day. Don't forget vitamin D3. Go ahead and take, I go ahead and take 1 of our vitamin D3 3 times a day, 1 at breakfast, 1 at lunch, 1 at dinner time. And that's going to help. Don't forget the OsteoFX. OsteoFX, go ahead and take that 3 doses a day. And the knees and the hips will grow back. This isn't a one-way street. Your bones have the capacity to grow back. That's why when you get a fracture, you're able to repair the fracture because your bone is rebuilding new bone. Okay, so this is something that's going on in history, and that's why they used to have the bone broth. Some of you are old enough to remember bone broth. You simmer bones all night on the stove in some water, water that had maybe some
Vinegar.
Yeah, there you go. Some vinegar, some kind of acid in it, vinegar, and it would suck all the minerals out of the marrow of the bones, whether it's rib bones or hip bones or vertebrae or something like that. Well, people started saying, it's kind of stinky. We don't like that in the house anymore. My doctor gave me some cortisone. It just worked as well or better. But then they started getting worse because the cortisone just relieves symptoms. It doesn't make things better. And it gradually gets worse and you're in real trouble. And so, again, on the knees and the hips, the CM cream anywhere in the neck, jawbone, hips, knees, but don't forget the glucogel, and don't forget the what do we say, collagen peptides. Okay.
All right.
Thank you very much.
Thank you, Dr. Wallach. And we had a question out on YouTube from a woman whose son has had MS for the last 12 years. So exactly what Dr. Wallach just recommended for this woman, age falls within that same not age, but weight falls within that same weight range. So whatever Dr. Wallach just mentioned for MS for this lovely woman, it will pertain to men as well. MS.
You have MS, they really should get the flip chart, 90 for Life, okay, crusade to save humanity and the world, page 26. Of the 35 different diseases that we deal repairing the brain and spinal cord, MS, multiple sclerosis, is number 3. We have so much experience with that. Okay, and it works every time. I'll repeat that, it works every time. And so it's one of the things where don't just keep taking cortisone, please.
No, it works. But folks, it does take consistency. It does take lifestyle changes to stop what toxicity is going into your body that's damaging the cells, that's preventing absorption of the nutrition. It's all in your hands. You're empowered to make a huge difference in your life.
Yeah, get the book. It's all in your head. Okay. And this, they're available right now, and it goes into these sorts of diseases, MS, multiple sclerosis. And
they are, there's a connection. It's amazing, Dr. Wallach, the overlap.
Yes.
Of the different things. Well, let's go to the next question. And folks, I just want to remind you that if you were shared this program by somebody specific, get back with them. And they should, if they shared it with you, then there's a possibility that they have their own way of getting products. And we want to make sure that we let them have the opportunity to be your resource in getting connected to that better health journey. If there's no one to thank, and you've never tried any of the products, feel free to give our team a call at 855-949-3377. Again, 855-949-3377. AJ, what questions are you bringing in today?
Hello, Dr. Wallach.
Hello.
Again, tons of questions. The first one that I want to address, because the topic today is osteoporosis of the skull and the different diseases that are associated. Peter is asking, Doc, is there any advice you can give on his trigeminal neuralgia?
Okay, I'll give you a rough, but they need to get a hold of the book. It's all in your head. Trigeminal neuralgia. That's called the fifth cranial nerve, right? Fifth cranial nerve is getting squeezed by osteoporosis of the skull. Okay, trigeminal neuralgia is very easy, and in weeks, I don't care if you had it for 25 years, in weeks it'll be much better, and maybe a month or two it'll be gone, because it has to do with osteoporosis of the skull. And there's actually pictures of osteoporosis of the skull on page 6 here. Okay, and so you want to make sure that you're getting all the information. You want to get all the products necessary to be able to do what's necessary to heal. But you can see the top one, the skull is a 1/4 inch thick. That's normal. The bottom one, the skull is 1.5 inches to 2 inches thick. That's osteoporosis of the skull. You can see, looking down on the brain in both of them, which one is going to have more blood flow into the brain? Which one is going to have more nerve function coming out of the brain to the outside world? Number 1. Okay, that's the healthy one. We can go from this to this in about anywhere from 4 to 6 weeks, depending on how good you are about staying on the program.
Okay, I'll get them on the program.
Yep.
Doc, a woman says her daughter's been suffering with allergies to indoor products for 8 years. The formaldehyde from the cushions cleaning products, makes her throat swell, car exhaust in traffic. She stays home most of the time. She eats well, no sugar, no gluten. She's on many YGY products, including Ultimate Classic, and gets A, B, C, E, and D, as well as other supplements. What can be done to mitigate this unrelenting situation?
Well, she needs the I-26. Okay, she needs 2 or 3 of those chewables twice a day, or if she wants the capsule, she can take 2 or 3 of those twice a day, or the powder. Okay, mix it into a drink. But she needs the I-26 because just taking a drug to relieve symptoms of allergies is never going to fix it. It's going to gradually get worse and worse and worse and worse and worse. And so to fix it, you got to give the body what it needs, the raw materials to heal and maintain function, in the nerves. And this includes the skin and the brain and the spinal cord and all the peripheral nerves that go through down into your fingers and hands and your back and your toes and all that kind of stuff. They all need help.
Thank you, Doc. Doc, last one for me. BB says that his brother got a infection growing from tissue. He had a deep cut. He's on 3 antibiotics. He's on the immune 911. What else can he do, as the bacteria may be hard to kill? And thank you, he says.
Okay. All right. Well, it needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown rind oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go. And then per 100 pounds of body weight, he needs 1 healthy brain and heart pack per month. He weighs 150 pounds. He needs 2 healthy brain and heart packs per month. Okay. And then when he's talking about all this stuff going on in his joints and bones, and is that correct?
Infection in the skin from a very deep cut.
Okay. Then I would also give him the hair, skin, and nails. You can take 2 or 3 of those 3 times a day, hair, skin, and nails. And he also needs our colloidal silver. He can take a dropper full under the right side of his tongue, under the left side of his tongue, say 10 minutes before breakfast, 10 minutes before lunch, 10 minutes for dinner time, 10 minutes for bedtime. The colloidal silver will kill viruses, bacteria, fungus, and yeast. Penicillin only kills Staphylococcus and Streptococcus. They don't even kill all the bacteria, whereas colloidal silver kills all bacteria. Okay, it comes in a dropper bottle, very easy to and I use it relentlessly every day because I see so many people, they want to shake hands and give you a hug and all this kind of stuff. And so I've been using the colloidal silver 4 or 5 times a day minimum. I'm on airplanes and buses and cars and big events, and again, shaking hands with so many people and everything. I use a lot of colloidal silver, and I also use the, let's see here. I also like the,
Are you looking at the killer biotic or the hand sanitizer, Dr.
the
Wallach?
hand sanitizer. That's what I'm looking for. Hand sanitizer. Okay. Because it on contact kills everything.
Brilliant as always, Doc. Thank you.
Okay. Well, thank you. And, let us know, because our listeners want to know how this person's doing. Let us know how they fare. Okay.
Thank you, sir.
God bless you.
All
sir.
right. Well, Dr. Wallach, I'm thinking we're going to have to keep your monologue to 5 minutes, sir, because we still have 7 hands and at least 10 more questions that we are not getting to.
Okay,
So
we'll do
let's do
tomorrow.
Wednesday. Next Wednesday, we're going to have a question only Q&A with Dr. Joel Wallach. Okay?
That's fair.
Okay.
Next Wednesday, you're talking about tomorrow?
Wednesday. Today's Thursday. Next Wednesday, Doc. Tomorrow's Friday. We will not be having a live Daily with Doc, as I will be getting ready to get on an airplane. So there will be a revisit. So you can make sure that you're following us on YouTube or Rumble, Brighteon, Twitter, LinkedIn, all the different platforms, and making sure that we are keeping the information flowing, as we do have so many people that are starting to wake up and realize that there's more that they can do to help themselves. So, Dr. Wallach, thank you again for being here and guiding us on this path to better wellness. If I could get my co-hosts up with me, I could not do this without them. This is a labor of love in many days, on many days. And I just want to say thank you to Ruth Ellen, the executive production manager who keeps us all organized. We have Sherry, who is part of our tech crew and helping to make sure that the stream gets set up and watches to make sure everything is flowing smoothly. We have Marilyn, who is here live in the Zoom room with us. Oh, they're all live with us, but she is here focused in the Zoom room because she does so much typing in the dictation and transcribing what is being said in the program to the chat that is only available if you're here live with us. So thank you so much, Marilyn, for all you do there. We have Albert, who is letting people in and making sure that everybody's cameras are showing things that are appropriate for all age groups. And thank you so much for doing that. And then we have AJ, who is out watching all the platforms. He is responsible for getting us on all of those platforms and making sure everything runs smoothly there as well, including bringing in questions, as Sherry did as well today. So, folks, there are so many different parts to making a successful team. If you've ever thought of surrounding yourself with like-minded people, people that are interested in helping others, interested in nutrition and doing it from the nutritional approach, then we invite you to be part of the team. Get back with the person that shared this program with you, as they probably have their own team. But if there is no one to thank, then the Daily with Doc team welcomes you, along with the Critical Health News team as well. Use info@dailywithdoc.com. Send us an email with your interest in being part of the team. If we did not get to your questions today, please send us your questions via email, questions@dailywithdoc.com, questions@dailywithdoc.com, and we will make sure that we do get your question answered. And Sarah, I did take pictures of your question. And something else that I want to make sure that we have clear is, please don't send questions only to me. Put them in the chat, because if it comes just to me and we've got so many things going on that I'm trying to keep track of, I might miss it and not get to it. But my team is incredible at taking those questions and helping to bring them in so that they are heard and so that they do get answered. So on behalf of the Daily with Doc team, thank you everybody for investing the time in yourself. Yes, this is an investment into you. You are your greatest asset, especially if you are responsible for taking care of others. Because if you're not there to take care of them, who's going to take care of them? It's a family ordeal, folks. We start with ourselves, just like an airplane. Anything happens, and the oxygen mask drops, put it on yourself before you help others. So let's make sure that you are finding your best. And we're going to invite you to our live show on. Is that what you got your hand up for, AJ? Yes, so Saturday, May 4th, we will be live in Newark, New Jersey. Coach AJ is hosting a great event where you can come and join us in person. And for those of you who aren't able to join us in person, we will be live streaming it on Zoom right here in DailyWithDocZoom.com, where you won't miss out. And we will be bringing in some guests. 3 hours worth of information. Will you unmute yourself and just spit it out, buddy?
That's right. 3 hours and at 3 p.m. Eastern time, which is 12 noon. So it's the same Dr. Wallach time, just on a Saturday.
and 3 hours instead of 1. So I'm looking forward to it. And we are excited to be able to bring more opportunities for people at different times, as far as days, I should say, different days, so that others can join in as well and have the opportunity to come live. So we're going to be doing some door prizes and giveaways, and bring a friend, because the person that brings the most friends will get a special gift from me. So thank you, everybody, for joining us here on Daily with Doc. Don't forget to check out our website, DailywithDoc.com. Bye, Dr. Wallach. Thank you
Bye-bye,
so
everybody. Bye-bye, Becca.
We appreciate you. And on the website, we have that good foods, bad foods list so that you can print it out and have it right there. Focus on those good foods. I know for me, when I was told I couldn't have something, I wanted it more until I got those nutrients, and I no longer had those cravings because my body was not starving. And then I could focus on those good foods and stick to it. Until next time, have a fantastic day, and let's help you find your best optimal health. Bye for now. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to